Hi there, my name is Josh with Turney Insurance Advisors, and very excited to be bringing you this video today, which is, I believe, a really important topic and one that I think trips a lot of people up, which is what's the difference between Medicare Advantage and Medicare Supplement, and how do I choose one? I have so many people that ask me, number one, what's the difference? And then once they hear the difference, well, how do I choose one? How do I pick? They both sound really, really good. So the purpose of this video today is going to be to clarify the difference between the two and to help you make a clear and confident decision when it comes to your healthcare. So very important to understand before we get into the differences between Advantage and Supplement is what is Original Medicare, which is the foundation of either of those options. Well, Original Medicare is made up of Part A and Part B. You've probably heard about those things. And usually if you're within 3 months of your 65th birthday and you're already drawing Social Security, you'll already automatically be enrolled into both, and you'll probably have your red, white, and blue Medicare card that says Part A and Part B on it. But what are these two, right? What do these things actually mean? So Part A is your hospital coverage. For the sake of simplicity, think about it this way. Anything inside of the four walls of a hospital is going to fall under your Part A, right? So it's anything inpatient. Part B is anything outside the walls of the hospital. So it's outpatient, doctor's visits, seeing a specialist, diagnostic testing, anything like that. As far as what these things cost, with Part A, if you've worked 10 years, or more specifically 40 quarters, you'll have Part A at zero premium. This is 99% of people are gonna pay zero premium for their Part A. If you haven't worked 40 quarters or 10 years, we would check to see if your spouse has, and if they have, that'll go ahead and take care of it. And if they haven't and you haven't, you can buy Part A coverage for a specific premium. Part B coverage is $185 a month. Above a certain income threshold, the Part B premium will go up. And I'll actually drop a chart right into this video so you can see how the Part B premium changes as your income increases. So take a look at that and kind of figure out which bracket you're in. Now, the only other thing I want to share with you before we get into the meat and potatoes is the exposures of Original Medicare. So what are the exposures of Part A and Part B? Well, with Part A, you'll have a $1,676 per hospital stay deductible that you have to meet before Medicare Part A will kick in. With Medicare Part B, you have a $257 annual deductible. And once you meet that deductible, you'll have a 20% coinsurance. Now, the problem here is that 20% has no annual limit. There's no cap, there's no restriction on how big that 20% can get. And where we start to see that get really costly and even put people in a position where they're eating into their retirement assets is in some sort of a catastrophic medical situation. Things get expensive, right? If you have a head cold and you go to the doctor, 20% is no big deal, right? Little sinus infection, not a problem. If you have a heart surgery, that 20% is a completely different scenario. So it's very important that you know what the exposures are so that as we dive into the supplement route versus the Advantage route, you understand how those options eliminate or at very minimum cover up some of these gaps. Okay, here we go. Let's put them side by side. So we've got Medicare Supplement on the left, we've got Medicare Advantage on the right. Let's break down Medicare Supplement first. You'll have your $185 Part B premium. Remember, that's with Part B, that's your premium you'll pay. Plus, on top of that $185, you'll have a Medicare Supplement premium that you'll pay directly to the insurance carrier. So the $185 is typically taken directly out of your Social Security check. As far as coverage with the Medicare Supplement, you'll see the lowest out-of-pocket costs when going to the doctor or visiting a hospital. So your Medicare Supplement is going to pick up on the majority of your Medicare-approved expenses. You won't have a network, so you can choose any doctors that accept Medicare. You don't need referrals. And a quick statistic is about 98% of doctors accept Medicare. So it's a really, really big majority. Now, you will have to have a separate prescription drug plan, which is also known as Part D. And so that's something that you would choose separately. Now let's transition over to Medicare Advantage. So how does this side of it work? The easiest way to understand it is Medicare Advantage is very similar to employer coverage. So it's managed care delivered by a private insurance company that basically takes Medicare Part A, Part B, and Part D and smashes them all together into sort of an all-in-one plan is what we call it. So usually your prescriptions are going to be covered in your Medicare Advantage plan. You'll have dental, vision, hearing benefits. It's all in one. You still pay that $185 Part B premium. You can't get away from that. And your Medicare Advantage plan itself will usually have a zero or very low monthly premium. In terms of your coverage, you'll have higher out-of-pocket costs at the doctor or the hospital as compared to Medicare Supplement. So that's what you're giving up in exchange for a lower premium. And you will have a network. So you'll have a network of doctors very similar to employer coverage, either an HMO or a PPO. There's different plans that fit different people's needs. So to make a long story short, the difference between Medicare Supplement and Medicare Advantage is simply the coverage. Medicare Supplement you're going to pay for, but your costs are going to be much more predictable. With Medicare Advantage, you'll have a higher cost share as you use medical services. You'll have some copays, you may have deductibles, you'll have a max out-of-pocket. Really, more than anything, it's just something to be aware of. There is no one perfect plan or one plan that works the best for everybody or one plan that we're biased towards. It's truly what floats your boat and what fits your needs. And at the end of the day, what leaves you with the least amount of surprises. Now, if you'd like a little bit more information or you'd like to meet with us directly, I'm going to put a link down in the description where you can click and you can book a call directly with us if you'd like to look at your specific Medicare situation. Hope this was very helpful for you. And if you have any additional questions, you can always drop it down in the comments below. And I hope to see you on another video coming up soon. Take care.